So if you have no idea what PA school is like, stick around because I'm going to explain it to you in under 2 minutes. I'm going to use the example of my PA program. My program was 27 months long. It included 12 months of didactic work, 3 months of advanced didactic work, and then 12 months of clinical rotations. My first year was broken down into 4 different semesters. I had summer, fall, winter, and then a second summer. During my first summer, I took anatomy with cadaver lab, physiology, pathophysiology, physical diagnosis, which is kind of like a physical exam course, as well as a few other classes. During my second semester in the fall, I took courses like EKG, clinical medicine, clinical laboratory, physical diagnosis 2, microbiology, ethics, and some other courses. Then when I got back from winter break in January, I took courses like pharmacology 2, clinical med and surgery 2 and 3, clinical laboratory, clinical behavior, and a few other courses. Then 3 months before my rotation started, I took a few classes, of which included a course where I learned bedside procedures, as well as some of the surgical skills required for the OR. And then finally, my clinical year involved 9 rotations in total. I first started off with psychiatry, then I went to OBGYN, internal medicine, emergency medicine, general surgery, pediatrics, pediatric intensive care unit, and then 2 different sports medicine orthopedic surgery rotations. I also missed family medicine. That was the second to last one that I did. So that's how my program is structured. A lot of these programs across the board are very similar because we all follow pretty much the same curriculum, but if you do have specific questions or want to learn more about each program, I would look into their website. So if you have any other questions or want to learn more about being a PA, feel free to hit the follow button.